Hi, my name is Sean Messina. I chose to do CBD and Epilepsy for my cannabis informational project. I was trying to set up something to film myself so I could show this and give it off and make eye contact with the camera, but I don't have anything I can set up to do that with, so I'm just going to give an introduction like this and promise that if I had a tripod, I would be making eye contact, but I'm just going to hold the camera and show off the pamphlet. Okay. So here's the pamphlet I made. It's an outline on CBD and epilepsy. So CBD and epilepsy, a guide for newcomers. A beginner's look into your newest non-psychoactive medical cannabinoid. For a little fun, it said, welcome to relief. So I kind of just talked about the routes that CBD can help. So to start, I outlined epilepsy, which is a seizure disorder caused by nerve cell activity disruptions, causing seizures. And this can occur from your genes or as a result of trauma or stroke. So maybe a head injury or having, just a stroke can bring these epilepsy disorders out. Some approved treatments already are nerve pain medications such as topiramate, gabapentin, and pregabalin, sedatives such as midazolam, phenobarbital, diazepam, and clonazepam, and anticonvulsants such as carbamazepine, topiramate again, phenytoin, felbamate, valproic acid, and I'm not going to go through all of these for you. I think you get the point. A lot of these are either benzodiazepines or just typical pharmaceuticals that you would think of. So CBD as a molecule, I've included the structure here. So what is it? Cannabidiol was discovered in 1940 and is the second most common naturally occurring cannabinoid. It is non-psychoactive. So how it works is it modulates the CB1 and CB2 receptors while having a low binding ability. So affinity is the word I should have used, but ability works here. So it likes to modulate the CB1 and CB2 receptors, like how the THC or endocannabinoids are binding, but it's not going to bind itself really, so there's not going to be a high. It also likes to activate the 5-HT1A serotonin receptors, and serotonin receptors are responsible for, emotional regulation. So what this ends up doing is it adds anxiety relief, nausea relief, prevents vomiting, and helps manage pain. And it is an agonist to the human transient receptor potential channels, the TRP channels. So this is the theoretical route that they believe CBD is taking to relieve epilepsy. So some risks from using CBD, just in general, the inhalation can cause irritations, coughing, burning throat, all of that, and combustion or smoking can cause cancer or introduction of carcinogenic molecules into the system. And to avoid this, you can use vaporization, and you won't have the drawbacks of smoking, but you'll still get that ease of titration and that instantaneous dosages that you would get from smoking. You can ingest it, however, it's harder to dose, and as we talked about in class, the CBD can convert into THC within the body, and this can lead to unwanted reactions or high when people wouldn't want it. So, how can CBD help you if you have epilepsy, of course? Well, what we know is that a study in Israel found that there was reduction in seizure frequency in 90% of the patients that were reporting, and these patients were, I believe, adolescents, and their parents were reporting for them. So the parents would be reporting how frequent the seizures were happening and like how often, how many per week. And so that they found that 52% of the patients that were reporting these reductions in seizure frequency were reporting significant improvement and improvement in quality of life. So there was another study, it was a case study done with a girl named Charlotte, and it was seen that she was a girl with Dravet syndrome, and it was seen that CBD drastically improved her quality of life and reduced her seizure frequencies as well. And this was also seen to work on a study done with dogs. So canine epilepsy is also seen to be reduced, or symptoms are seen to be reduced in canines as well. So diving further into how this works, it's thought that the CBD is modulating calcium via the human TRP channels, and this is resulting in lower seizure frequency. And so how to use the CBD? Personally, I would say inhaled in vaporization. This is the fastest, most easily titratable dose, and it has the highest bioavailability. And as I put here, vaporizing is generally safer for health. It can also be ingested with a low bioavailability, so a long onset, harder to dose, and there's topical methods as well. So anyway, that was CBD and epilepsy. I've learned a lot going through this. At first I wanted to do THC, and I really had I thought, all I'd heard was THC, and reading through both assignment 2 and this, it really seems like CBD is the best option for at least epileptic treatments, and the best benefit is that there's no high with that, so we can treat people without the risk of them walking around stoned, which is always something that I would think about when that was the treatment option. Anyway, thank you for watching this, and I hope you enjoy.